Good afternoon. I'm Janine Kokel. I'm a patient educator with the Stephen and Barbara Slaggie Mayo Clinic Cancer Education Program in Rochester, Minnesota. I'll be moderating today's session. We're just so happy and glad to have you with us today. Angie Murad is our speaker for today, and she is one of the patient educators here in the Cancer Education Program as well. She's going to be presenting our first survivorship webinar in a 6-webinar series. All webinars are on the first Wednesday of every month, starting at 1:00 p.m. Central Time. These sessions will be recorded and posted on Mayo Clinic Connect. Mayo Clinic Connect is a digital platform where patients, family members, and caregivers can connect, get evidence-based information, and get access to information about classes and programs webinars our center offers. We encourage you to follow the Cancer Education blog on Mayo Clinic Connect so you can stay up to date on educational opportunities. I'll put the link in for the Mayo Clinic Connect for our education blog site page in the chat function in just a moment. We will take questions at the end of the session. If you have any questions related to this webinar topic, please type them in the chat function at the bottom of your Zoom screen. With that, I want to please help me welcome our speaker, Angie Murad.
Thank you, Janine. I also wanted to mention too, we are recording this session. So for those who are unable to attend this session at this time and for future survivorship webinar series, we will always record these sessions. So just to let you know of that as well, and wanted you all to be aware. And it too, if you wanted to view the session again, we will have it on our Mayo Clinic Cancer Education blog. So as Janine mentioned, this is our first in a series of 6 webinars, and this is the first one, our transitions after treatment. So I just wanted to mention that this information in this webinar is kind of just to have a disclosure that the information is not intended or implied to be a substitute for personal medical advice, diagnosis, or treatment. We always want you to work with your physician or any qualified healthcare provider when adjusting medications, supplements, or making any lifestyle changes. So just want you to know and be aware of our disclaimer for this webinar. So I thought I would start out by talking about what does it mean to even be a survivor. So the American Cancer Society uses the term cancer survivor to refer to anyone who has ever been diagnosed with cancer, no matter where they are in the course of their disease. So not everyone who has or has had cancer identifies with the term or the phrase cancer survivor. For some people, they don't feel that this term speaks to them or is right for them. They may feel more comfortable defining themselves as a person who has had cancer, a person living with cancer, or another way. The term cancer survivor identifies a community of people with a history of cancer, either at the time of diagnosis, during treatment, or after treatment. The effects of cancer don't end when treatment ends. So people with cancer who have had cancer are living longer due to improved care, screening, and then even newer treatments too. But it's important to be able to explain or discuss your medical and emotional needs with your health care team and also your loved ones. That's why people should find the words that they are most comfortable with to name and navigate their personal changes and challenges that they have come from their cancer diagnosis and treatment, and even beyond treatment too. So first of all, in this webinar series, we are using the term cancer survivor to identify anyone who has recently completed treatment. So as I mentioned, it can be anywhere in that cancer journey, but most of the information that we're providing does pertain to people who have recently finished treatment. So we want this information to be as helpful and applicable to people in this phase of their cancer journey. And I also wanted to mention where us as patient educators are located. We're here at the Stephen and Barbara Slaggie Cancer Education Center. And this is at Mayo Clinic, our comprehensive cancer center. And we're a National Cancer Institute designated 3-site cancer center dedicated to improving the lives of cancer patients and the community. And that's why too, we want to offer these webinars because yes, our center is located here in Rochester, Minnesota, and we do provide education to all 3 enterprise sites, so Arizona and Florida, as well as the health system. But we too also find it very important to reach out to our community and educate the community. And so we just wanted to let you know where we're located and are charged with doing these webinars. So Janine had mentioned Mayo Clinic Connect. She will be putting, or if it hasn't already, put that link in the chat. And it's a platform where family members, caregivers can all connect with this evidence-based information. This is too where we will put the recording like I had mentioned, and you can stay up to date on upcoming webinars. And if you're a Mayo Clinic patient, also classes that we offer. And like I said too, or actually I didn't mention this, so I want to make sure that I mention that you don't have to be a Mayo Clinic patient to follow and connect with others on Mayo Clinic Connect. I just want to also point out some of the topics that we are going to be doing in this survivorship series. So this is our first one, and then we will be addressing other topics that we feel are important and also follow the NCCN guidelines on topics that are most important to cover for cancer survivors. So with emotions, shortly after treatment, so that mind-body connection. We'll be talking about some more wellness topics related to physical activity and nutrition, and then also how to manage certain side effects like having good sleep hygiene and managing cancer-related care. And then in December, at the end of the year, we'll be kind of wrapping up our series on how to put all this information together in order to put together kind of an individualized action plan of maybe what you want to focus on to not only survive, but also thrive after cancer treatment. So let's begin. Transitions after treatment. So our learning objectives for today are creating a new life routine with family, friends, and colleagues. How do we go about that? Understanding the importance of follow-up care. I'll be discussing the role of the treatment summary and survivorship care plan, and discovering resources during the transition from active treatment to follow care and beyond. So defining a new normal. We thought we heard of a new normal during the pandemic, but this can also be a term that can be used as people finish that phase of active treatment into finishing up treatment. As treatment ends, we know it's likely a time to rejoice. People are often so grateful that they are done. People often describe the first few months after treatment as a time of change. It's not so much as getting back to normal, but really it's a time of finding what's normal for you right now. When dealing with a cancer diagnosis and treatment, you often don't get much time to process what's going on and happening to you. You can only just look so far ahead at any one point in time, just kind of soldiering through one day at a time with those appointments, and sometimes even just hour by hour or minute by minute. So now as you transition into that aftercare, is really now a time to process what's happened to you. And really to also think of it as an opportunity to take stock of your life. It may be the first time you can really process all that you've been through. While in active treatment, you may look a couple steps ahead, enough reserve to just do the next thing that may just have to be required. Yet now you might find yourself in a position to look further ahead in larger spans of time. For some people, they may have a hard time adjusting after treatment ends as they enter that back into busy schedules and life routines, while also managing some of those lingering symptoms. So that's why too, we want to make sure that we address some of those symptoms like fatigue, having less energy for daily tasks. And also too, it can feel uncomfortable to have less contact with your healthcare team because again, you're kind of, when you're in that active treatment phase, you feel like you're having those touch points and seeing your care team. And as you move further and further out and beyond past treatment, you may not see your healthcare team. And that might be nice to not have to be going to all those appointments, but it can often be a time, which I've heard from people, to be a little scary because you're not really as much on the radar. But I think it's important to really feel that you've experienced and think that you've experienced a significant life event, and life will be different. And it can look different for each person. So one person may describe it one way, someone completely different. And it's perfectly normal to have a flood of emotions while adjusting to this, what we call new normal. And that's why too, our second session discusses that mind-body connection, addressing some of those emotions. But I think too, it's really important to be gentle with yourself as you navigate this new normal. You can look back at what you've gone through and feel that you have had a chance to look a little bit farther ahead on maybe what you want to work on or making some changes in your life. And as you transition from cancer treatment to wellness, you may be scheduled for a cancer survivorship visit. This visit provides education and resource and possibly a treatment summary and survivorship care plan. So I wanted to touch on this treatment summary and survivorship care plan. It can be considered a personalized roadmap that's based on the type of cancer that someone was diagnosed with, the treatment they've received, and if they're experiencing any lingering side effects of the treatment that they received. It can be in the form of paper or electronic document. And it's just the care that someone who has had, and two, it can also be someone who's still undergoing that maintenance treatment for cancer as well. But one thing I want to mention is that this treatment summary and survivorship care plan, not every patient is going to get this. It requires, for a patient who requires one if their cancer treatment course was not complicated. So they may not get one if it's not complicated, but all patients should receive follow-up care. And I'll be talking a little bit more about that. So the purpose of this document is to successfully manage care from that acute oncology phase to the everyday life in primary care. So when people go to their doctor for follow-up care, they can provide their doctor with the information about what type of oncology care they received. And really too, I've even heard this treatment summary and survivorship care plan often being just described as the follow-up care, but it's so much more. And I'll be walking you through an example of one. The most widely used definition of survivorship care involves 4 different elements. One is the prevention of recurrent and new cancers, the surveillance of for cancer spread and the recurrence or second cancers. And it's also going to assess medical and psychosocial late effects of treatment or cancer. And then it's going to also address intervention for consequences of cancer and its treatment. For example, if someone experiences lymphedema or sexual dysfunction, or even pain or fatigue, it will address that as well. And then it can even follow up on psychological distress experienced by cancer survivors and their caregivers too, and any cancer related issues in regards to employment, insurance, disability. So a lot of different things that it addresses. And most importantly too, and I put this as the 3rd bullet point on this slide, but really coordination. So you're coordinating care between specialists and primary care providers, oncologists, to ensure that all of the cancer survivors' health needs are met. And I'll also provide some resources kind of towards the end of this presentation, and I'll make sure that I put any of the resources too with the recording when I put it on our video library tab on our Mayo Clinic Cancer Education blog. And as you transition from that active treatment to or transitioning out of care, you may have so many questions. And the most important thing is being an active participant in your follow-up care, which means that you connect with your care team and get these questions answered and find the resources you need. And that's why we really feel that this survivorship series is so important. So I also stress too to patients that I work with, if you have questions, it's really important, and you might have even experienced, I'm sure you experienced this too, having so many questions as you entered treatment or even after you received your diagnosis, to really have a notebook to write down some of these questions. That way you can lift it off your mind, keep it captured so you don't forget about it, and make sure that you address that question. And like I said, that treatment summary and follow-up care document that you'll receive really helps answer some of these questions. But as you talk with have those follow-up appointments, or if you have one of these treatment summary plans, or I'm even going to suggest where you can find one yourself and fill it out. But a lot of these questions can be answered. One important question too that many survivors have is, what if you have financial concerns? I wanted to just touch on this a little bit because cancer is so expensive. It's an expensive medical condition to treat, and most patients will need ongoing follow-up care after they've completed that treatment. Unfortunately, it's very common for patients to deal with financial stress all throughout their journey. And the term financial toxicity is often used to describe the treatment-related financial strain experienced by patients with cancer. However, we know the financial impact goes beyond this active treatment phase. So I just wanted to let you know one resource that we have available to address this financial toxicity is our Cancer Education Center has recorded a 3-week webinar series on financial toxicity and cancer. And it addresses the financial toxicity in the way of medical insurance, employment concerns, as well as financial planning. And all of these recorded webinars are on our Mayo Clinic Connect. If you go on to click onto the More tab, you'll see a video library link to go to, and that financial toxicity series is at the very bottom of all of those recorded webinars. So I just wanted to make sure that you're aware of that resource to you. And then we too have even a resources sheet on financial resources too to help you with that. So here at Mayo Clinic, we have patient navigators that are located in our center to help people navigate some of these concerns that people might have. But if you're not a Mayo Clinic patient, you might have navigators. You most likely have social workers, possibly financial counselors at your facility to help you answer some of these questions. But regardless of the many questions you have, the treatment summary and that survivorship care plan can help answer a lot of these questions, like I mentioned, that you might have. So next I wanted to talk about follow-up care. Like I said, this treatment summary often is referred to as follow-up care. It is a section of that treatment summary and survivorship care plan, but I just want to make sure and that I stress that follow-up care, whether you get that treatment summary plan or not, everyone who finishes cancer treatment must receive follow-up care. And follow-up care just means that you're seeing a doctor for regular medical checkups. And I mentioned there's a section that's specifically labeled follow-up care. I'll talk to you about that. But the follow-up care for each person really depends on the type of cancer they've had, the type of treatment they've received, and your overall health. And this is just generally speaking. So it is not specific at all, but generally, survivors usually return to the doctor every 3 to 4 months during the first 2 to 3 years after treatment, and then once or twice a year after that. But again, it's very dependent on the type of cancer you've had, the type of treatment you had, how extensive the cancer was. So really just want to stress that again, where that disclaimer comes in, it's so individual for each person. And then, and the follow-up care can also help find the support that you may need as well. So this is just a very quick overview, just showing you this treatment summary and survivorship care plan. So this is the actual paper document. Some are on the electronic medical record, but I'll be going through each section as I go through slides. But what I want to mention is that these 2 websites on the left are places where you can find an example of this general cancer survivorship summary, treatment summary and survivorship care plan. And it can really record the cancer treatment and all that follow-up care that you need. So I want to mention, so that first website that I listed is from the American Society of Clinical Oncology, or in other words, ASCO is that first website. And then this is the same treatment summary that you can find on there. And then you can also find cancer.org, which is the American Cancer Society website, and they've partnered with ASCO to also have these treatment summary and survivorship care plans too. As I mentioned, this is a general cancer survivorship and care plan, but they do even have specific ones. For example, people that may have breast cancer, cervical cancer, lung or colorectal cancer. So those will be very specific and have a little bit different things that to check off or fill in with on the form. But really too, so this is the front of the summary, and there's also a back side. But want to mention that this really allows patients the ability to reclaim control over their health and arm them. So if they see new physicians or go to their primary care for checkups, they can provide them with all of this information. They will have all that is needed on there to effectively manage their care for prevention, surveillance, and that intervention if anything arises in their follow-up care. So essentially, the treatment summary and that survivorship care plan is a mechanism to promote and coordinate that care. And then this is the back side. So let's walk through this form, kind of have it separated out. So it's divided into several sections, and the first up at the top in the light blue I kind of circled is the general information. So it just asks who your oncologist is. It begins with the providers that you saw, their names, their contact information, their email, and all who were involved, that oncology care team who were involved in your treatment. Next is that treatment summary, that's in red in that rectangle. And that will talk about, that's where you fill in the information on your cancer diagnosis, when you were diagnosed, the location, the stage, what type of treatment you received, whether that was surgery, radiation, and then if you did receive radiation, to what part of your body did you receive that radiation? If you received chemotherapy, what type of medications did you use to treat? And then also there's even an area of persistent symptoms, kind of moving down a little bit after the completion of treatment. So if you are experiencing persistent symptoms, listing what they are. And then at the very bottom, before you get to that bottom of that big red circle. It also talks about familial cancer risk assessment. So that's where you would fill in if you had any genetic risk factors, you could list those there, any predisposing conditions, or if you received any genetic counseling too. You can put all of that information in there and fill in that genetic testing results too. So it's quite extensive, and it really captures all of the information of your treatment there. And that's why it's called that treatment summary. Then you saw kind of at the bottom of that first page is that follow-up care, and that's in that red circle. So that will be if you need any additional treatment or maintenance treatment, it's called. So sometimes people may need additional chemotherapy or hormonal therapy, immunotherapy, or targeted therapies that just help lower the chances of the cancer coming back, or also called cancer recurrence. And some types of leukemias or lymphomas require maintenance therapy during remission to just, again, reduce the recurrence and improve the cure rate. And for those particular types of cancers, like the leukemia and lymphoma, that cancer maintenance therapy is a very common part of standard treatment or usual care. Up at the top too, they even talked about any additional treatment. So they talk about that adjuvant treatment. So that just means any additional treatment that's applied after the additional treatment for cancer, especially to suppress secondary tumor formation. So just to kind of define what that means. Then you'll also see that schedule of the clinical visits kind of in this section here. Who are you going to be seeing? So again, answering some of those questions. Where do I go for my care for follow-up? How often do I go? What type of tests do I need? So again, just kind of going over and answering some of those types of questions. So that surveillance, they're going to perform certain exams, tests are going to be done on a regular schedule to monitor if any early signs that disease might be coming back, so a recurrence or any new cancers. So that's just kind of going over that follow-up care. So too, even at the bottom here, I just kind of want to point out down here, it even talks about please continue to see your primary care for all of those screening tests, follow-up tests, and noting anything new that's a new symptom or a persistent symptom. So just anything that you're worried about, to just reach out, and again, make sure that you reach out to someone so that we can so that they can coordinate care. So then too, this next section is kind of talking about possible late or long-term effects that someone with this type of cancer and treatment may experience. So they may list certain things that you may experience, but again, in this red section, any of those lingering symptoms or side effects, trying to coordinate that care. So whether that's emotional, mental, or if it's related to physical care, the fatigue, fertility, if you're still struggling with stopping smoking, again, that financial piece, if you're struggling with that, this is really where they're going to help coordinate some of that care. And then if you require with that physical piece, I'll talk a little bit about how to coordinate care with different clinics and things like that, or other providers. With weight changes to how can you coordinate care with that? And then in the purple at the bottom is that section that's going to talk a little bit about health promotion strategies. So are there any areas that, again, to coordinate care, whether that's diet, alcohol use, tobacco, wanting to make some changes with physical activity, weight loss or weight gain. So again, coordinating that care. And that's really walking through each of those sections of that treatment summary and survivorship care plan. And so it can be something that's done at that survivorship visit. But again, it's something that you can download from those websites that I provided, and even fill out yourself and get some of those questions answered that you might have. Now, I wanted to talk a little bit about some resources for some of those concerns that you might have, either those lingering side effects or different things you might want to work on. Cancer rehabilitation is something that we have here at Mayo Clinic, and many facilities have that. But we just I want to speak to a little bit about what Mayo Clinic has to offer. And getting a cancer diagnosis and being treated for cancer and living beyond cancer can be stressful, but there are ways to cope and resources available. So this cancer rehabilitation is a program that helps people with cancer. So it can be something that someone even in the early stages of diagnosis, during treatment, or after treatment, anyone can receive the cancer rehabilitation. So just want to mention that. But I don't want people to forget that it can be also used as people finish up treatment. And it involves many types of specialists working together to develop a personal rehabilitation plan that addresses the physical, psychological, and that cognitive side effects caused by the cancer diagnosis and its treatment. The personal plan considers your preferences, the strengths and goals of what you want to achieve, and participating in a cancer rehabilitation program may help you experience a fuller and quicker recovery too. So that's why just wanting to put a plug in for cancer rehabilitation and what it can do. And the goal is really to help you stay as active as possible so that you can participate in work, continue to engage with family, and also life roles that you feel are important. So obviously it's going to improve the quality of your life. Lessen the side effects and symptoms of the cancer and its treatment that you may have received, help keep you as independent as possible, and as I had mentioned, improve the quality of life. So some of the specialists that you could coordinate care with are vocational counselors. They support people in returning to work. So maybe you had a gap of not working when you're receiving treatment, and maybe you're transitioning back into work. So they can help people learn how to do daily job related tasks more easily, so that they have a returning to work after your cancer treatment. And sometimes people experience cognitive problems that are related to their treatment. So again, having the conversation, realizing that this is something that's important to talk about with your provider, with your oncologist, as you approach that survivorship consult, but they can even suggest possibly working with a vocational counselor, because they can help you if you experience like difficulty multitasking. Maybe you feel like you aren't thinking clearly, or you have mental fogginess or memory trouble. So they can really help with some of those things if you're dealing with that. Then here at Mayo Clinic, we have integrative medicine and health can offer services that can help with physical, emotional, spiritual, and the mental health, as well as the well-being of people. So again, depending on where you've received treatment and where you go for your follow-up care, that's something to consider if integrative medicine is something that might be a possibility. So they use different practices that are not traditionally part of conventional medicine. Some examples might be acupuncture, massage, yoga, and meditation are just a few of the things that they can offer. But they're all of these services are evidence-based for their effectiveness and safety. So they're also used with conventional medicine too. And then also too, we'll talk more about some of the issues with emotional things that people may be dealing with as they transition after treatment, but just considering counseling, because some people just may feel better about having a person-to-person connection with a counselor. Now, a lot of counselors too do counseling online. So, that's another thing. If you don't feel comfortable or having to, it just makes easier traveling too, to go to different appointments. So just something to consider. So your cancer care team may be able to recommend a counselor who works with cancer survivors. So, it is nice if they do have that connection with cancer survivors, but they don't always have to be someone that has that. So just, again, if it's something that you really feel is weighing you down, that is, a counselor could be someone to work with. And then even considering counseling in the realm of faith or spirituality. Religion can be a great source of strength for some people, finding new faith during their cancer experience, but others find themselves maybe questioning their faith. So if you are a religious person, relying on a minister, a rabbi, or other leader in your faith, or a trained pastoral counselor, they can help you with identify your spiritual needs and find spiritual support too. And then spirituality is also important to many people. So even those who don't have a formal religion, and many people are comforted by recognizing that they are part of something greater than themselves, which helps them find meaning in their life. And often people, not always, but sometimes people may have a different perspective on life once they finish treatment. So some of those areas may incorporate meditation, practicing gratitude, helping others, spending time in nature, are all of the many ways to address some of those spiritual needs. And then support groups too. So I want to mention even Mayo Clinic Connect. So I mentioned our Cancer Education Center has its own blog, but there are other groups. So blogs have information-based on Connect, but then there are groups, which are just individuals who have something in common that connect with one another, and you can follow other groups. So there's many different, you can even search in the groups and find different ones. For example, there's a general cancer group. And then there are even different networks too, like Cancer Survivor Network, where you can find joining with one another. It's similar to what I described on Connect, or even Live Strong community programs too. This next slide, I just wanted to show you, which again is, I'm just going to kind of show the groups, and this is just a general cancer group on Connect. And someone posed that they're just saying that they were a cancer survivor, and they kind of described their situation. And then people were able to connect with one another. It had hundreds of people connecting with one another. So sometimes it's nice just to be able to connect with people in the comfort of our own home. So just wanted to show you about Connect and how people can talk with one another virtually. And then I wanted to touch on resources for health promotion. I talked a little bit about what if people want to gain weight, lose weight, that smoking cessation. So really, a lot of these health promotion strategies are really where we can kind of take control. Often with recurrence, some things it's harder to not be able to connect with our care team. But when we can really work on our physical activity or our diet or different spiritual things that we need, that's when we can really regain control too. So and there's other individuals that you can coordinate with, whether that's, for example, our cardio oncology clinic here at Mayo Clinic. We have doctors who are trained in heart disease, or cardiologists that evaluate and treat people who have heart disease or who are at risk of heart disease, whether that's before their treatment, during their treatment, or after their cancer, being treated for cancer. And people may see the cardio oncology clinic if they've developed a heart condition or complications after their cancer therapy. So because sometimes the chemotherapy medications or the radiation that they've received can cause some of those complications with the heart. This clinic can provide lifestyle coaching for people to reduce the risk of the risk for heart disease and maintain good health through diet and exercise. But I will also say there's other clinics that have physical therapists, occupational therapists, and then for dietary changes, I did mention this cardio oncology clinic, but even just seeing a dietitian through your healthcare facility or in the community, they can help make small incremental changes if that's something you want to work on. And then smoking cessation programs. So your doctor may have the resources, or this presentation I mentioned was going to have some resources to help you to make some of these first steps. But whatever steps you decide, we know that change is hard, and that first step can be the hardest. So we are here to support you, as well as your doctor, your family, friends. I think it's important to know who to tap on, who could be your best supporter, your care team members, social work clergy, and as well, that's why we put together this series. And even at the end of the series in December, how do I even put all of this information together to have it be a workable plan? So in conclusion, I feel like I gave you a lot of information, but really we want to just stress, creating a new normal can be hard when you've been through a significant life event, and recognizing that. Not everybody wants to, but if you choose to, it's important to be gentle with yourself, kind of at the bottom right, making sure that you're an active participant in your follow-up care. That's so important. Every person that's received cancer treatment needs to receive follow-up care. And we wanted to provide resources to be able to create that treatment summary and that survivorship care plan, whether that's your oncology care team, that if they provide that, or we want to give you the tools so that you can do that for yourself too. And then two, at the Stephen and Barbara Slaggie Cancer Education Center, we want to provide these resources all throughout your cancer journey. So as you transition through treatment, we want to help cancer survivors thrive, not just survive. So here are some resources. And again, I mentioned I will put these back up on Connect once I get the recording, which does take a couple of days to get back. So just want you to know. So these are a few. Connect. There's the Survivorship Clinic here at Mayo Clinic. Then there's the National Coalition for the Cancer Survivorship, National Comprehensive Cancer Institute, American Cancer Society. I have a couple websites for that. And then even some work and financial resources too, because again, transitioning from, if you took a break from during your treatment of not working, that can also be difficult to kind of transition back into work. And these are some work as well as financial resources that might be helpful in getting some questions answered in regards to that financial toxicity that often some cancer survivors face. So, all right, with that being said, I am going to open it up to questions and answers. I feel like I've been talking a lot. I'm sorry.
No, it was excellent. Thank you so much, Angie, for that really lovely introduction into survivorship care, and as well as thinking about navigating that new normal, and really the whole concept. It's a nice review of the concept of a treatment plan or a succinct history, a survivorship care plan, and how important that how really important that is for people to have something like that. And I always think of it, if you're traveling, especially, it's nice to have that succinct paperwork with you, because sometimes we can't always recall those kinds of things when we're trying to think of it in our memory. But it's, if you are traveling and you're in a different country and you have a medical issue pop up, it's nice to be able to give that to the providers, and so they can really very quickly be able to access and know about your medical history. It'd also be great and coordinate future care of other care a person's had so down the road. So thank you. I thought you touched on a lot of really wonderful concepts. So I'll see what we have for a few questions here. It seems we have one here. The question is the treatment summary and survivorship care plan filled out by us, by patients, or by our doctor's clinic?
Yeah, so it really depends on the type of cancer diagnosis that you have. Some types of diagnoses are not very complicated, so you may not get a survivorship treatment summary and care plan. But that being said, if you that's why I really wanted to provide people with that information, and knowing that that type of document can be downloaded, whether that's from that first website, that ASCO, or the American Cancer Society. You can certainly download a general cancer treatment summary and care plan and fill that out yourself. So it can be done either way. But some, I know, for example, at Mayo Clinic, in the breast cancer breast clinic, they often do that treatment summary and care plan. So not all patients will get that. And correct me if I'm wrong, Janine, I don't know if they were at one time always required to do that. I know now they are not required for all patients to do that, but I don't know if at one point they were required to do that.
I think they were really working towards that.
Yeah.
Year by year, trying to encourage more of that being done by facilities, especially cancer centers. But it does seem like there's a number of challenges with it. It just seems like finding who can fill it out and complete it, and
yes,
and having that consistency is been somewhat of a bit of trick for a lot of places to be able to find the people and time to do that. So, but I know that they do give you a summary, some type of a summary of care and treatment. So, sometimes if you take charge of it, you know that those questions are being answered, or you can ask those questions and they can get them to you so you're taking control, and you know that what areas you need to get filled out.
Exactly. That's what I was just going to say at the end. Yeah. Taking ownership, being your own advocate, getting the help that you need. And I know that may be hard, especially if you've finished treatment, you may be fatigued or not have the energy for that. But that's where, if you have someone who can really be by your side, whether that's your spouse, a family member, a good friend that could really help you with that, that can be so important. Yeah.
Thank you. I have one more question here. If a person has multiple conditions, including cancer, with many different medications and supplements, is there a specialist area that can review all medications and supplements and make sure they coexist and what they can be taken with?
I know here at Mayo Clinic, and I'm blocking the name in my head, but there is a specific clinic that will review all medications as well as supplements. But I wouldn't think all healthcare facilities have that. Perhaps a pharmacist might be someone else too that could do that, because like I said, Mayo Clinic can be quite specialized in the different clinics we have or departments. But I'm wondering if a pharmacist would be someone which would be found, anywhere, that could help you with that. Because that's a very good question, because depending on what type of those, maybe some maintenance medications, they may interfere or interact with certain supplements. I think having that looked at and making sure things aren't interfering or interacting, that's something important. Because the other thing too that I would say, just in my background in nutrition, is that sometimes you may not need to take a supplement, and they can be quite costly. So that's another thing to also realize, is that, I could probably, or maybe perhaps, get that nutrient or supplement, something that's in that supplement, in the way of foods, and it just reduces someone's cost, because we know that that can contribute to financial toxicity too. Medications are so costly. So
I just wanted to jump in to underscore what you said about pharmacists is always a great person to go to, because they even have specific online formulary programs that they go to kind of help look through,
be most up to date.
It's almost impossible to keep track of all the hundreds of thousands of drugs, but they have these programs that help them to look at that and sort through that. And another person maybe for supplements is somebody like an integrative
Yep.
medicine specialist, just because they might have the vision or to look at, they're looking at the content, the research, what's happening in those fields of studying different herbs, supplements, and things like that to see what its interactions are. But I
Mhm.
think finding one of those two would be a go-to that we would probably go to.
Yeah. No, that's good. When you started talking again, I'm like, yeah, that's who I forgot to mention. So good. I'm
No,
glad you
that's
said that.
great. Yeah.
So good. Yeah.
Trying to see here if we have other questions. I think that is it at the moment.
Okay. Okay. Well,
But
good.
again, I just wanted to reiterate, I thought it's an excellent program and really reviewed a lot of content, but very good and pertinent content. Thank you so
Great.
much.
Yeah, you're welcome. Thank you. Well, again, it'll take a couple days to get that on Connect if you want to watch again. And I will put those resources out there with the websites that I recommended. So thank you. Have a great day, everyone. And please, one last thing I almost forgot to mention is you will be receiving a survey that will be emailed to you. So please fill that out so we can get feedback on how we can make changes. And then we'd love to have you join us too on the first Wednesday of every month for our survivorship series.